Okay, so Fred has cried out, and I've come into the lounge room and he's been on the couch slumped over, seems to be having one of his seizures. So the first thing I did, I went straight to the cupboard where he keeps all of his medication and his forms, and I grabbed his care plan and his medication. So I've been timing how long the seizure's been going for, and it's coming up to 4 minutes now. So with his administration order for Midazolam, it says here that if the seizure lasts longer than 5 minutes, he needs to be given his medication. So I need to get ready to give him his medication. Okay. So I'm making sure that there are no hazards around him. He doesn't have anything sharp that he can fall onto. And I've got the care plan with me. So what I'm going to do is check the name on his form, the expiry date, and the dose and the volume. And I can see that the expiry date is the 12th, 2024, which means it's safe for me to administer. So it says on here as well the volume, which is 1 ml. Okay, so I know what volume. So what I'm going to do is I'm going to put my glove on. Okay, and I'm going to wipe away any excess saliva or mucus. Next, I'm going to get the ampoule. And the syringe, or the buckle, and I'm going to open it. Okay, pop this in. Make sure that I've got 1 ml. Okay, so I've got 1 ml in. And so it says to tilt his head to the side and position the ampoule between his cheek and, sorry, between the inside of his cheek and his teeth, and it's important so not to put it in the teeth so he doesn't bite down. So in between the cheek and the teeth. So in between the teeth and the cheek. And then I'm going to slowly squeeze the ampoule to give the medication. And because he's lying the way he can, I can actually do half on each side of the cheek. There we go. Now, if I was giving this intranasal, I would be tilting his head back and squeezing 2 to 3 drops in each nostril. Okay, now once I've administered the medication, I'm going to call the ambulance. Okay, so once the ambulance is on the way, I'm going to put Fred into the recovery position. And I'm going to stay with Fred and observe his breathing until he's fully recovered or until the ambulance get here. I also need to be prepared to give resuscitation if he needs it. Okay, so once the paramedics are here, I'm going to grab his care plan and all the documents, and I'm going to write down exactly what happened, so for his records, so what happened, how long the seizure went for, what I did, etc., and make sure that all of that's in his records.